or whatever. So, all right. Hey guys, we are so excited. We have a surprise for today. Should we tell them what the surprise is?
I'm really excited about this surprise because talk about the timing. We know you guys are in between your 8-week courses, so we're hoping you're tuning into our weekly programs. And we think this topic is going to be really spot on today. Although some of you already have your jobs, some of you have not started job searching yet, which is okay. Some of you don't know what you want to do or where you want to work. It really doesn't matter because our special guest today is going to fit just about everybody's.
You kind of just rolled in that our special guest, like without any fanfare. That like that's like the big enchilada, like the big excitement, that drum roll moment. It's our first guest star.
That's right. We do have a first guest star.
And you just kind of blah blah.
That's me.
So anyways, I hope you guys are excited. Like we're stepping things up in the world and having our very first guest star on our program. And I think we should introduce her and get rolling here.
I think we should.
So we have Gelly. Oh my gosh, I can't even.
She can't say her own name.
No, Gelly is with us. Kelly Gilhausen, is that correct?
Yes.
All right, is with us from Metro, and she is the Nurse Residency Program Coordinator. But before we get started, you know, since this is kind of like a cool defining moment for our show, we thought we needed to treat it with such like respect with being the coolness factor. So we thought that we would give her like a nickname, like a super cool guest star nickname.
Oh, I like that.
You like that idea?
What should we call Kelly? Or Gelly? Is it Kelly or Gelly?
Stop it, Meanie.
Okay.
Don't make fun of people. So our extra special guest star today, I thought the name Metro Kelly would be cool. It's combining her name and where she works into one. Like I was conjuring an image of like downtown Julie Brown, you know, met back in the day, you know, just something cool. I don't even remember like all that she did, but I just remember that was cool on MTV back in the day when.
Metro Kelly could be like an upcoming rap star.
Anything, rock,
rap. You could have your own show, Metro Kelly.
Yeah.
I love that you dated yourself when you talked about MTV, but go ahead. I'm with you.
I know. We do that often.
I get it.
Yeah, we do that often. We give our ages. We give our, you know, generations, because we got some different generations going on here. So we cover all random kind of stuff here.
We do.
And we are old farts, and they know that, and they still love us.
we think. So, in our minds, they love us.
Absolutely.
Yeah, right.
So, Di, you want to start with the first questions to throw out here at our extra special guest star?
Yeah.
Hello, everyone.
Thanks, Kelly, for coming on. First of all, we're really excited. We just, actually, to tell students, we just met Kelly last week. It was a meant-to-be meeting, and she was a perfect fit, not only because of her topic, because of what she brings to nurses, new nurses, and her philosophy. So Kelly, tell us just a little bit about you and your background and your philosophy, your approach to teaching new nurses.
Absolutely. So thanks for having me. I'm so excited to be your first official guest on your not live talk show. I love it.
And she does air quotes.
I
too.
love
You're
that
perfect.
she does it.
The bunny foos.
See, so I'm Metro Kelly. Welcome.
Yes.
So I am an old school. So I'm going to go back. I'm an old school diploma nurse back when they had diploma programs, and I actually went to nursing school at Metro Hospital. They used to have a nursing program right in their facility, and they closed after 100 years, and I was their 100th and final graduating class.
Wow.
Which was, I know, you didn't know that, did you?
No, that's a new fact about you we're learning.
Little fun fact, there'll be a test at the end. No.
Okay.
So I graduated from Metro's School of Nursing with a diploma, and I worked my senior year as a nurse intern in the neonatal intensive care unit. And when I graduated, they offered me a job, which I was super excited to take. And I spent 25 years working in the neonatal intensive care unit. I will come back to that and tell you about my one regret in life and as a nurse, but we'll get to that later. Remind me. So I spent 25 years in the NICU, best job in the world. I still keep in contact with some of my former patients. Some of my former patients are now mothers themselves, so it's really cool to see. And I was the old diploma school nurse that swore I would never go back to college. I said, I am not going back to school. It's too much. I'm not doing it. No. And then about 15 years into my career, a group of friends and I got together and we said, why don't we all go back to school and get our bachelor's degree? So we, together, a group of 5 of us, we went back to school online and we got our bachelor's at OU. And they all said, we're done. And we all said, oh, thank God we're done. We'll never do this again. I waited about 5 months before I enrolled in my master's program. And then I went back to school and completed my master's program because it turns out I really enjoy teaching. I really enjoy watching that light bulb moment come on with students. So I went back to school for my master's and then swore I would never, ever, ever do it again. I am currently enrolled in my 4th DNP class. So lesson learned, never say never. While I was in the NICU, I will tell you the bulk of my career, so the last 20 years that I was in the NICU, was spent precepting and training new nurses. And we'd hire a lot of new grads. Personally, I really love new grads because they come with a blank slate. I don't have to undo any bad habits. And new grads are always excited to learn, especially when I give them homework. And at first they look at me like I'm nuts because they're like, wait a minute, this is a job. I have homework. And I say, yeah, because everything you learn as a nurse does not happen from 7 a.m. to 7 p.m. You have to go home and look stuff up. So we will be at work one day and we might be talking about a new disease process. And I'll say, all right, before you come back to work on Friday, I want you to go look this up. Now, you don't have to write me a research paper. You don't have to, I just want you to have a general idea of what's going on. And then when you come back to me on Friday, I'm going to ask you what you know. And it's okay if you don't have all the answers. Tell me what you know and I'll fill in the blanks. And because what I really want to get through to the new grad and to you guys is that learning is ongoing. It's an ongoing process. Even me, who spent 25 years in the NICU, there were times there were new medications, new equipment, new diseases. And I think, I don't have time at work. I'm working in ICU. I am busy. I don't have time to look stuff up. But I go home at the end of the night and Google is your friend. Just be careful of the sites you go to. They're not always reputable. And I would search for stuff and I would have a better understanding of what was going on with my patients. So I got to do that with new nurses, which was awesome. And then, let's see, about 4 years ago, I took over the preceptor program at Metro because we all are in school to become nurses and we all know how to be nurses, but we don't necessarily know how to teach. And now you're a brand new nurse. I'm sending you out to a nurse on the floor and saying, teach them how to be a nurse. Just because you're a good clinical nurse doesn't mean you know how to translate that information and teach someone else how to do it. So for the last 4 years, I get to teach nurses how to teach, which is so much fun. And then in October, I took a new job and I am now the nurse residency coordinator. I'm still doing the preceptor program. I do both now. And I get to work with all the new graduate nurses. So any nurse that has less than 365 days experience gets to come through our nurse residency program at Metro Health. So I've gotten to do a few things in my career. I know other careers, some people have a much more varied background. Mine isn't hugely varied, but predominantly what I've done for 20 plus years is teach and educate, and that's what I like to do.
Can you help us and the students understand the difference between like a nurse residency program and just like an orientation program?
Sure, absolutely. So here, let me give you a little background. So this is orientation week at Metro. So yesterday, all of our new hires started at Metro. And no matter if you're a nurse with 20 years experience or you're a brand new grad, yesterday was hospital orientation. It's a general orientation. Today, you do LEAP modules from home. We have a lot of modules that you need to read about, our policies. Everybody does that on Tuesday. Wednesday, everybody kind of does that. and then you'll come into the organization for an hour and a half, and you'll do a couple skills in our skills lab. Start an IV, restraints, NP swabs, something else. Central line dressing change. Everybody gets that. The experienced nurses after tomorrow are done. They go onto their floor, they work with their preceptor one-on-one, and they start their orientation. That's it. Nurse residents get a little extra. So after Wednesday, you guys come back to me on Friday, and we have a whole fun day planned because I'm fun. So you come in the morning. You come in the morning, and we start off with a meet and greet because I don't know you and you don't know me. And then we have our director of respiratory therapy come and talk to us about all the different type of respiratory modalities that you'll see in the hospital. And then we go back into the skills lab and we do some extra skills. We do trach care, NG core packs. We do a code basics room. We do hanging IV medications and bags and actually programming pumps. Everybody gets to do that. And the really fun part is the unsafe room. So I don't want to, I'll give you a blur. So the unsafe room is basically you're going to get report on a patient. You're going to go into the room and identify all of the things that are wrong when you do an assessment on that patient in the room and on that patient. And there's about 23 things wrong in the room. So there's a lot to find wrong.
That's so cool.
It is. Oh my gosh, they love it. And I have a practicum student starting with me this summer, and I have given her the task of creating an escape room. So future coming down the pike, we're doing an escape room. So I always try to change stuff.
That's so cool.
It'll be fun. And then you guys, let's see, that's the morning. Oh, then we do a tour because Metro's really big. And most people don't even know how to get from the parking lot to their unit. So I make sure you guys know how to get to your floors, where the cafeteria is. We go to the morgue. Everybody loves going to the morgue. We go there. I take you to our transformation office because if you don't know, Metro is building a brand new hospital. We are moving into a brand new hospital in August of 2022, state of the art, gorgeous. So we walk down to where all the construction workers, the architects, the planners, and 9 times out of 10, one of the 2 senior vice presidents at Metro Health is down there when we're there, and they give the tour and they tell you about it, which is really cool.
That's amazing.
And then we do a Jeopardy game.
Question? I'm being the polite student here. So this sounds all wonderful. I'm like pretending I'm a student here, but you kind of have me stuck a little bit at that skills lab. Like, is the skills lab like nursing school when we had our test outs where we had to know like right away and can't use a piece of paper, and if we don't like identify ourselves before we wash our hands, we fail. So can you make me feel a little bit more comfortable with this?
All right. So okay. You've now known me for 4.5 minutes. I'm pretty laid back.
Hot minute.
We're all professionals. We're here to help you, not to make you feel incompetent. Here's the reality. You're going to walk into that skills lab and you're going to look at that simulated trach patient and you're going to be like, yeah, I read your policy on LEAP yesterday, but I don't know what to do. That's okay. There's going to be an instructor in the room with you that's literally going to talk you through it. And then you get some hands-on practice. That does not mean I expect you to go onto the floor next week and be able to do it independently. You are still going to have a preceptor teach you that over and over again through orientation. It is not the expectation that after you go through skills lab, all of a sudden you can go and start IVs by yourself because you did it on the simulated arm. Nope, that's not happening. It's just some extra help for you. That's all it is.
Wonderful. Kelly,
does that make sense?
Yes. No, that gets like those butterflies out of my stomach because when I hear skills lab, and especially like at like a new job, that makes me kind of freak out. Like, oh my gosh, do I have to do it perfect or I lose my offer? So thank you for clearing that up for me.
So we know our students are really, really focused a lot of times on those skills because they're so intimidating in that. But what's above the skills? Because we can teach skills, Kelly, but what are we looking for, that is a little more challenging to teach that we really want to focus on in school and really in the residency program as well, probably.
Absolutely. So Friday is our skill day, right? Because we know as new nurses, you're nervous about that. We know that you're worried about starting an IV and putting on a Foley and hanging a med. We know that, and we understand that so much that we do that simulation on Friday, but we bring you back on Monday and we pair you up with a nurse in the organization, and you literally wander around the entire organization to the ICUs, to the emergency room, to endoscopy, and you start IVs and you hang meds and you do trach care and you do dressing changes and you put in Foleys and you whatever we can find for you to do. You get to spend an entire day doing that without a patient assignment, not on your floor, just getting practice, because we know you're worried about that. But having said that, that's such a small part of what we do as nurses. And I know that you're nervous about it. And let me tell you, this is God's honest truth. I got hired as a nurse in 1996. I know some of you probably weren't even born yet. And I had never put an IV in an adult. I had tried, but I never had a successful IV, ever. So when I started, of course, that's tangible to me. I can start an IV, or no, I can't. And I hadn't. So I was nervous about that. And I will tell you, it didn't take long before I figured out how to put an IV in. And now I can put an IV and a Foley catheter in a 400-gram infant lickety split. Because those are tangible skills that we can teach you along the way. So if you don't get that opportunity in nursing school, don't even worry about it. I'm not concerned. What I want to make sure you know how to do is think through a problem. And that comes with time, and you're beginning to learn that. I don't expect you to be perfect when you first start, but you have those basic core concepts down. That's what we're looking for in that new graduate nurse is, are you willing to ask a question? Why? Why is this happening? Does this make sense? What is the rationale for why I'm doing what I'm doing? And when you start to answer and ask those questions, that's how you grow your critical thinking skills. I don't care if you can put an IV in a patient. I can teach you that. What I want to know is if your patient needs their last dose of antibiotics and you know that patient needed 5 attempts to get that IV and that it's a horrible stick. I want you to think, am I going to poke that patient 5 or 6 times for that last dose of antibiotics? Or am I going to maybe call the physician and say, do you think we can give that last dose IM so I don't have to keep poking Mr. Smith? That's the critical thinking we're looking for. And I think you're getting that, and you have the basics of that. And the only way to continue to grow that and get better is to keep asking the questions. Why are we doing this? Can you explain why this is happening? What's the rationale for this? And that doesn't stop. 25 years as a nurse, I am constantly asking my docs, how come you ordered that? We used to order this, and then they give me a rationale, and I go, oh, that makes complete sense. But you have to keep asking.
That's a great example.
Mhm.
I mean, I don't think that could be said enough. We tell the students that too, but hearing that from you in your position really makes all the difference in the world. And we hope it's comforting to you guys as well, watching.
Right. And question for you again, as student Carrie here.
Yes.
Okay, so if we keep thinking and learning and asking, who do we ask these questions to? Do I ask them to like Dr. Google when I go home? Do I ask them to my cat? You know, who do I ask these to?
So there's so many people. This is the thing. So when you get hired into an organization, your first point of contact, if you're in a nurse residency program, is going to be me. I'm always available, but with a caveat, if you're in an adult ICU, I always say, if you weigh more than 10 pounds, you're kind of SOL. I cannot help you. I've never taken care of an adult patient. You want to know about neonates? I can answer whatever question you need. You want to know pathophys of pulmonary hypertension? I can teach you that. But when it comes to adult stuff, I'm not the expert. So your first point of contact is going to be your preceptor. Your preceptor who's going to be with you for those 6, 8, 12 weeks, you should be constantly asking them questions. The other unique thing, I'm going to give a plug here. The unique thing about our preceptor program, many organizations, the way it works and the way it used to work, I know for me personally, is I came to work one day and my manager said, hey, there's a new person starting your precepting. Okay, well, what does that mean? And I don't want a precept, but you didn't really get a choice. And I'm not going to say that never happens at Metro, but the way that we're different is our preceptors have to want to precept. They have to hold a bachelor's degree currently. They have to put an application in with their resume. They have to have 5 peer evaluations from their coworkers saying they would make a good preceptor. Their manager has to approve it. Once they do all that and they're accepted into the preceptor program, they come through an 8-hour workshop that I teach that teaches them how to teach, so you guys get a good experience. And then every year we require them to come through a 4-hour class where we are constantly doing professional development with our preceptors so that they're keeping up to date and teaching you correctly. So we put a lot of effort into our preceptors so that when you're on the floor, those nurses that are training you are the best of the best. And those are the people that you're going to ask. And you're going to be meeting with your preceptors and your managers every week, every 2 weeks during orientation. You're going to have time every day to sit down. We actually have a form, a daily evaluation form, where you're going to say, these are the skills that I learned today. These are the patient assignments that I took today. These were the challenges that I had today. And this is my goal for the next day. And you're going to write that out and you're going to sign it so everybody's on the same page. So we're going to know what you need. If you're struggling with understanding the medications on that floor, we're going to figure out a way to help you understand that. We might hook you up with our clinical nurse specialist. We might give you some extra modules to do. We may work with you one-on-one. The thing about our orientation is there's a general orientation, but there's room for individualization. It's not everybody gets the same thing everywhere because everybody has different needs and everybody has different strengths and different weaknesses.
That's awesome. And that's what we talk about is finding that job. We know, your first job doesn't have to be your job for life, but finding that good support system is so important, and somebody that's invested in you and that wants to help you, especially as a new nurse. Absolutely. I think that's like the most intimidating thing going out there is like, what kind of environment, the whole nurses eating their young, which I'm sure that you experienced, Kelly, in your era, as we all did. We just try and, guide our students to places that are going to be friendly to our new nurses, especially in the COVID times. I mean, the pandemic we just went through this last year. And I'm sure they feel like their training has been slighted a bit because they didn't get into the clinical area as much as they should have. So all those points that you brought up, I'm sure all our students, because we think about them all day, every day, are very concerned about.
And this is, what you're talking about here sounds so wonderfully structured and in a way that's both like academic, but also fun and supportive, and that, ooey gooey, feel good component too. So these are good things to consider, you guys, when you are going about your job search. Ask about what type of programs are there to help support you as a new grad. Ask for specifics about it, like we had Metro Kelly telling us today. I mean, you can tell how passionate she is, and how well thought out this program is, and all that is there for you guys. And so if you get these like specifics and tangible takeaways, that it's legit, and that this organization really wants to help and support you, as a new nurse.
And I think Kelly also brought some good points that you can bring into interviews with you too, students, like ask some of these questions that she says that their institution does, because those are important points. So you can ask, who's going to be my preceptor? If I need individualized training, who do I go to? Is it a one for all? Am I done when I'm done with my precepting or my nurse residency? Is that it for me? Can it be extended if I don't feel comfortable? These are all really good points to ask. Because don't forget, in an interview process, you're being interviewed, but you're also interviewing that institution as well, because it's got to be a good fit for both of you. There's a lot of time and money, right, that goes into orienting. And you want a good fit.
Right. And I think that when we talked to you last week, you shared a little bit about something that you would do, like walking around the hospital.
So,
You want to share a little bit of that?
so sure. So what I told you about for our residency program is just the first couple days. That's just the beginning of it. We also do in the first week a simulation, although I changed the name because when I said simulation, people cried. Apparently there's some negative connotations that go along with simulation. So now I call it interactive learning. So we do some simulations, interactive learning. Again, you can't fail. If you kill your patient in sim, it's okay. We're not worried about it. And then you go out onto your floor, but that's not the end of the program. Once you get out onto your floor and you're working with your preceptor, you're going to come back to me 5 times over the next 12 to 15 months for professional development classes. So it's about every 3 months. Pre-COVID, they were in person 4-hour classes. Unfortunately, they're Zooms, but I still try to make them fun. And during these 4-hour classes, we talk about how are you going to grow as a professional nurse? I'll tell you, when I started in the NICU, and I'm sure you've experienced this, I remember being at work looking at some nurses and thinking, I want to be like that when I grow up. They were so intelligent and so compassionate, and their skills were so good, and they could speak with the physicians, and they spoke with families, and they explained stuff so well. And I remember thinking, I want to be like that when I grow up. But I didn't know what that meant. And nobody ever told me. And I thought by coming to work every day, somehow by osmosis, I would become this great NICU nurse. And I did learn a lot. And it wasn't until about 10 years into my career that I had a mentor say to me, hey, why don't you become the education coordinator for our unit? Why don't you help me on a PI project? Why don't you speak at a national conference? Why don't you write a book chapter? So along the way, I had this mentor who kept kind of poking me. She kept poking me, which was great because there were some things I just didn't know. Because in nursing school, you're so focused on getting through school, you're not thinking about your long-term career, right? So in our classes that you come back to me for, we talk about things like teamwork, delegation, time management, work-life balance, diversity. We spend a lot of time this last month dealing with the emotional and mental toll of COVID. We have our employee assistance program come and talk with us. We do some career development. One of our last classes is I help you formulate a career development plan. So I really want to invest in you, whether you stay at the bedside or not. And let me throw this caveat on here because you're listening and I can. There is nothing less than about being a bedside nurse. Being a bedside nurse is probably one of the most difficult and rewarding jobs you'll have. And if your goal is to stay at the bedside for your entire career, that is an admirable goal. I did it for 25 years. But what I'm going to say to you is if you're going to stay at the bedside, be the best bedside nurse you can be. Not every nurse needs to go back to school to become an FNP, to become an educator, to become a manager. Yes, we need those too, but we need quality, engaged, educated nurses at the bedside. And I pray that a lot of you stay at the bedside because I think what you have brings value to your patients and to the organization. And I don't ever want you to say, I'm just a bedside nurse. There is nothing just about that, nothing at all.
You bring up an excellent point and something that we start to see students coming to us as they're getting closer to graduation, getting our opinions on things, and sometimes, or even graduates in the past, couple of years talking about going back to school and hearing about their classmates or former classmates. Everybody is like either wanting to go back to be a nurse practitioner or a nurse anesthetist. And like there are students who don't want to do it, but kind of feel because everybody else is doing
Pressure,
that,
yeah.
is there, why am I not feeling that way? Maybe I should be feeling that way. So thank you for bringing up that point of, follow your own passion, do what you want to do. Don't be swayed by anybody else, even if it's a field that not everybody, is always the most interested in. My dear, geriatrics and older people, we need people who like all the different areas. And
Right.
like Kelly said, there's nothing that's less than compared to all of the other areas. So.
Right. There's nothing more heartbreaking to me when a student says, well, I think I just want to be a med-surg nurse. Is that okay? I'm like, are you kidding me? That's one of the most important jobs. You don't have to specialize. Yeah, I did ICU. I was similar to you, Kelly, and I went right into adult ICU. But a med-surg nurse is it's one of the most important. And if that's your passion, you go for it. Thank goodness we don't all like the same thing, or we'd be in big trouble.
And taking that even kind of a step further, working outside of the hospital setting is okay as well. I remember being in nursing school, and I can't remember if it was directly said, but it was definitely implied that the good RNs work in the hospital and the not so good RNs work elsewhere. So I purposely chose to work in long-term care because I wanted to do administration, and I like working with older adults. And so I felt awkward at first telling people that that's where I chose to work and I wanted to work, and because people look down at you like, oh, you're gonna get a job in the hospital, or oh, you must have like barely, gotten by your program. So, it's okay to follow your own passion. I like to kind of represent the underdogs out there that, are maybe in fields that aren't always the most popular, but those are the fields that we really need people in. So really follow your passion and don't let anybody dictate or sway your thoughts of where you want to work.
Let me just say, remember I said I'm going to tell you about my one regret in nursing.
Yes.
Let me, this is the God's honest truth. I would not change my career at all. I loved my 25 years in the NICU. In hindsight, if I could do it differently, the one thing I would do differently, honestly, is go to a med-surg floor for at least a year, because I have zero adult experience. Other than nursing school, I have never taken care of anyone over 12 pounds for 25 years. So even just those basic adult skills, I guarantee every one of your students listening is better at adult nursing than I am at this point. I mean, they are, because I can't do it. I couldn't. Could I go to an adult floor and learn it at this point? Yes, because I have enough knowledge, but it would be more difficult. So I have a lot of new nurses who want to work labor and delivery. They want to work NICU. They want to start right off in an ICU. Listen, some advice: don't negate the amazing knowledge and experience you will gain from a med-surg floor that you will not get anywhere else. When you go right into an ICU, it can be extremely difficult because you have to be good, and you don't have as much time to work on your time management skills because you're in an ICU environment. It is very easy for a nurse with 10 or 15 or 20 years adult experience to come to labor and delivery or a NICU or a PEDS floor. It is much more difficult to start off in those areas and move to an adult floor later on. You become very specialized very quickly. So don't pigeonhole yourselves, take lots of opportunities. And even if it's not the greatest experience, look at it as a learning experience. I'm going to get through this. Every hospital has a minimum requirement for how long you have to stay on a floor. Metro's is 15 months. So if you get into it and it's not the greatest thing in the world, it's 15 months where you're learning, you're building your knowledge, and then you can apply to go someplace else.
And you kind of bring up a point that's excellent. I think in tying it with something you said earlier about seeing nurses that you wanted to be like when you grew up and you liked how they did things and whatnot, and combining that with like maybe an experience you don't absolutely love. You also, when you're working with individuals, you'll also see people who you maybe don't want to be like when you grow up. And that's important learning skills as well. So take the good that you see in others, remember the things that are not so hot that you don't want to emulate in others. And all of that together is going to really help shape your career.
That's a great point. I always say that too. I love that.
And
Well,
don't
we're out
ever
of
be
time, Kelly.
sorry.
So we know that you have so much more to say. So is it okay that we share your contact information with students on our website so that if they are
Absolutely.
interested or have more questions that they can directly contact you? Because I think you hit on a bunch of great topics, but there's so much more to be said, and I'm sure they have many more questions as well.
Yes.
So
and I would take it after, watching this video. If I didn't have a job yet, I would want to go from these two crazy kooks to someone else that follows the same vision as we do and feel, warm and embraced and, having support. So
yes.
So we would love to share your information.
Feel free to reach out to me, share my email address. And if not, if you can't remember it, you can email nurseresidency@metrohealth.org. That comes to me also. So email me, shoot me your questions. I would love to chat with any of you.
Oh, that's great. And thank you what you do, Cal. You're awesome at what you do. You make it fun, and it would be a great transition for any of you looking for a job out there to go look up Metro Kelly.
Yep.
I almost want to, I won't leave the university, but I kind of want to come through a residency program with you, Cal, because I think we would have fun.
We want to come test out that escape room.
Oh, I want to.
See if we're stuck there forever. We get out. Well, the two of us together. We kind of two together make one.
It would be fun.
Yes. So, all right, students, we'll see you next time. Take care. Bye-bye.
Bye-bye.